Hello, everybody. I'm Karen Ousey, and I'm the current president of ISTAP. I'm also Emeritus Professor of Skin Integrity at the University of Huddersfield and Adjunct Professor of Wound Care at Monash University. And myself and the President-elect are going to give you a brief overview of our strategic direction for ISTAP for 2024-2027. But Ray, would you like to introduce yourself?
Hello and welcome, everyone. My name is Dr. Samuriwo. I'm an associate professor in nursing at Edinburgh Napier University, and more importantly, perhaps, also president-elect of ISTAP. So, welcome and thank you for taking the time out to go through the ISTAP strategic direction with Karen and I.
So ISTAP always have a strategic direction for 3 years. And we met last year to develop our new strategic direction for 2024-2027. But it's important to us that yourselves as members fully understand where we're going to and how we actually got there as well. And we also want you to be interested in what we're doing so you can see what we want to do and you're able to contact us if you have any ideas as well when we plan our next strategic direction. So prior to us meeting, what we had to do is have a look at what we've been doing in the previous 3 years. So it is very much an inclusive organisation, ISTAP. So we all had a meeting and we looked at where we were now. So we celebrated our successes, but we also wanted to know what's our strengths, weaknesses, opportunities and threats. And also to look at the political environment as well and how we could fit into all of this. We also want to be very clear of where we're going to go for the next 3 years. So we undertook a visioning exercise and a mission exercise, and I'll share with you shortly what our mission and vision are. We also wanted to think, well, we've all got these really good ideas, but what could actually get in our way if we don't look at this clearly and effectively? So we know that we have to look at values and behaviours, but it's important that we look at risk analysis as well. So how important is skin testing in the healthcare environment, and how do we actually get our message out there? We know what we want to do. We want to ensure that we have a world without skin tears. So what do we do for that? So we've set strategic priorities using SMART goals, and we've also developed action plans and also communication plans, and we've looked at what we're capable of doing. So you can see our vision is a world without skin tears. And we have a mission to be a truly global interprofessional collaboration where we're going to be dedicated to improving skin tear prevention and management for everybody across a continuum of care. And that's really important. We're looking at young people, we're looking at neonates as well as older people as well. But what we really want to do is identify how can we prevent skin tears as well as managing them. And we're going to do this through evidence-based practice, education, research and advocacy. So you can also see from this slide what our values are. And we have 5 very clear values: inclusivity, inspiring, innovative, integrity and interprofessional. And we all work towards these values, the vision and the mission as well. And we want to share these with all our members. So the slide in front of you shows our research, our information, collaboration and education training. And you can see that all of these together form ISTAP. So we want to be custodians of research and best practice. And we don't just want to undertake research, we want to embed that research into practice. So as we've just said, we're very interested in research and evidence, but it's important that research and evidence is embedded into practice. And we do this through education training. So we try and set standards for skin tear education. We want to provide continuing education, but we also want to influence curriculums globally to ensure that they have skin tears embedded within them. We're also curators and custodians for knowledge, and we gather information and we ensure that's kept updated. And you can see that from our website where we have a resource section that has all the different information that you need for skin tears and managing skin integrity. And for ISTAP, it's important for us to work in collaboration with everybody. That includes healthcare professionals, patients and carers and industry. And when we talk about healthcare professionals, we're talking about nurses, medical staff, occupational therapists, podiatrists, pharmacists, etc. We want to include everybody in our work. So here is just the three guiding strategic priorities that we have. We have board governance, where we want to have a strong mix of skill sets and qualifications. And we always seem to be quite top heavy with nurses. So we want to include occupational therapists, physios, etc. We also want to ensure that our past board members are included and integral to the further development of ISTAP. So we have consultant roles, but we also have conflicts of interest policies in place. We have key partners, and you're able to see these partners on our website if you want to go there and have a look. And importantly, we do want to raise skin tear awareness. But as we mentioned earlier, across the care continuum and across all healthcare areas and all ages as well. But we want to make sure that everybody is informed. So one of our key aims for the next couple of years is to ensure that undergraduates are taught about skin tear management as well. And we're also going to try and influence government and public awareness to ensure they understand about skin tears as well.
Thank you, Karen. So in order to bring to life ISTAP strategy, we have a number of projects that we're working on this year and will be taking forward for the coming years. So I'm just going to talk through a few of the key projects that each of the work streams is focusing on for the next few years. So in the education work stream, the focus is very much on developing a suite of skin care online educational models. We're also working on a skin care webinar and also annual World Without Skin Tears Day, the next one of which will be in 2026. In the research and evidence-based implementation workstream, we have a number of projects that we're working on. The first is a paper on health economics. We're also looking to develop a paper on translation guidelines that will enable people to translate the ISTAP documents into different languages, because again, aligning with our value of inclusivity, it's really important to us that everyone's able to understand and utilize the information that we have to share. We're also carrying on with one of our more recent projects, which is highlighting the latest research every year and updating our recommended reading list as well. We're also very keen to undertake a project for all skin tones to ensure that all skin tones are represented in the classification of skin tiers to try and address the underrepresentation of people with dark skin tones. In the global community engagement workstream, they've taken the lead on a joint project with the European Wound Management Association, EWMA, which is very much focused on living with skin frailty and skin tears, which is very much focused on patients and the public, their experiences of having skin tears and living with frail skin as well. This workstream is also leading the implementation of a data collection tool, which we hope to be able to share with everyone more widely in the few months ahead. Well, the workstream is also working on implementing the best practice recommendations, which have been jointly created with WOCN and NSWOC. The second edition has actually been published at the time of recording, with a made easy summary to come in the next few months as well. We're also very keen to continue engaging with our members through the communique every month. In the collaboration and partnership workstream, we're strengthening our existing partnerships with other organizations through memoranda of understanding. We're also working quite closely with our through industry collaborations and partnerships, and also enhancing our annual corporate partnerships. So I'll just summarize 7 key projects that we're focusing on over the next couple of years. The first project is the Skin Tears online educational modules. Education is a very important part of our work because it's about making sure people have the information that they need to prevent skin tears and also to treat them as quickly and effectively as possible. We also plan to have an annual skin tear webinar to provide people with information and updates on the latest innovation and information about skin tear prevention and treatment. We also intend to continue with our annual World Without Skin Tears Day, the next one of which will be on the 9th of April 2026. We also have our joint project with the European Wound Management Association, which is focused on people living with skin frailty and skin tears. We'll also continue to progress our project on health economics of skin tear prevention and treatment. We're also very keen to do some implementation work to embed our data collection tool into practice to drive forward improvements in skin tear prevention and care for the benefit of patients. We'll also be looking to implement the updated best practice recommendations that we jointly developed with WOCN and NSWOC. Last but not least, as Karen highlighted, one of our core values is inclusivity, and we believe very much in working in partnership. So thank you very much for spending time with us as we've gone through our strategy and our key objectives for the coming years. In order for us to be able to achieve all these things, your participation and engagement is key. So please think about joining ISTAP, become a member. It's free to join. There are already more than 4,000 people who are part of our global community. And your help, insight, guidance, and support is key to us being able to achieve our strategy. Thank you very much, and please join ISTAP. You can click on the QR code or go to the ISTAP website today. Thank you.